Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, it is my pleasure to welcome Courtney Hoganson. Courtney is a registered nurse. She's a serial entrepreneur. She's a legal nurse consultant. She's an innovator, and she belongs to several organizations, including Aging Life Care Association, Alzheimer's Association, and the Texas Nursing Association. So, welcome, Courtney.
Thank you for having me.
It's my pleasure, Courtney. What drew you to nursing?
I think nursing is one of those things that finds you and it becomes a calling, whether you know it or not. And I think it was always in my plan, whether I knew it or not, I was always going to be a caregiver of some type because that's what my family has always done.
Yeah.
And my parents took care of their parents. My dad's dad lived with us when I was in high school. He had Alzheimer's. And so I just was very familiar with the caregiving side of the family. And, I think I thought I was going to do something else. I went to UT Austin. I studied radio, TV, film. I ended up in Los Angeles. I thought I would be a writer, producer. And I worked at Nickelodeon, which was really fun for a few years. But then I just felt like I needed to do something more, where I felt like I was doing something meaningful on a daily basis. And so I went back to school to become a nurse.
Yeah. Okay, so you came to nurse with a lot of other different kinds of experiences.
Yeah.
Was it what you thought?
No. I mean, I had a roommate in college who was a nursing student and her mom was a nurse. And I didn't grow up around any nurses. So I didn't really have a great understanding of what it was. I always thought it was, more of like the nursing assistant type thing. And I thought, well, I want to do more than that. I guess I have to be a doctor if I'm going to do more than that. I didn't realize that nursing had this whole other advanced practice at the time. And so the thing that drew me to nursing as an almost 30-year-old was the flexibility to know that if in 2 years I decided I didn't want to do adults, I could go into pediatrics, or I could become a NICU nurse, or I could go back to school and become a nurse practitioner or a nurse anesthetist. And I liked that you could continue to build off of that. And so I went in and I decided I'd go for the cardiothoracic ICU at UCLA. And I just dove right in. I was like, well, I'm going to choose the hardest, most challenging spot. And it was great. It was a great place to learn. I'm so grateful for having spent those couple of years on that unit.
So, choosing what you saw as the hardest, most challenging spot, what were those challenges?
Oh, man. Just holding your own in the CT ICU at UCLA. I mean, you would have to get up in front of these renowned surgeons and doctors and these intensivists, and they would round. And, granted, in the ICU, you only had 1 or 2 patients, but they were critically ill. They were sometimes on, 13 vasoactive drugs. There was so much going on for each of these patients. And I learned to really manage, all these things we needed to do, but then also proactively think about, okay, how are we going to get this person better? What are the signs I'm looking for? And you'd have to be able to stand up in front of this team of other experts and present this patient. Like you're the expert on this patient, and you really were the advocate and the spokesperson for that patient and their family. So, it was like a sink or swim situation. It was like you can get up there and fumble, but like your patient needed you to be an advocate for them. And so it felt really like I was making a big impact in these people's lives. And I thought, gosh, it's such a privilege to be able to help shepherd these people through this very confusing healthcare system.
Yeah. And I'm glad you used that word privilege, because it is.
Yeah,
It
it really
absolutely
is.
is. It absolutely is. What though, would you like to see change?
Ooh, I think the biggest thing is, the reimbursement model for nursing. I think a lot of people, even nurses, are not aware of this. But nursing is actually, it's roped in like a room
Yeah,
charge. It's
yeah,
like
it
a
is.
box of tissues, or and really it's so much more of
Mhm.
like you think of PT, OT, all these different types of therapies and specialists, they all have
They're
billing codes.
billable. Mm-hmm.
And I just think, why do nurses not have that? Because the skill set that I had was completely different
Yeah,
from what a nurse in, NICU could
yeah,
do, or labor
yeah.
and delivery. And
Mm-hmm.
it made sense for me to keep, upping my practice, and I would be able to take care of these really, really complicated patients. And it's kind of like, why doesn't a nurse,
Mm-hmm.
why can't he or
Exactly.
she charge a higher, if you're giving a higher level of care? It's like, if you're a doctor versus a surgeon, you're taking a lot more risk
Taken.
and you've got a lot more specialty, and it's like apples and oranges. And
Yeah,
so I think that would really help the profession to really feel like we're offering a service, a very valuable service. And I think nurses should be able to bill for those services in all sorts of,
yeah.
scenarios, not just the hospital, not just the clinic.
I absolutely, absolutely, absolutely agree. I mean, they bill for a lot less things, They bill for band-aids for Pete's sake. I mean, Anyway, so you founded, one of the things you founded was Call Light. So
That's
what is Call Light? Why did you do this?
So that's my newer thing. So in when I was at UCLA in the ICU, I saw all these gaps in our care system, and I noticed so many people went home, and I felt like they didn't have that continuity of care. They didn't have a team of people. They didn't have the expert or the advocate. So I transitioned into becoming a patient advocate. So I would have like 10 patients at a time where I was the expert. I was the patient quarterback. I would go to doctor's appointments. I'd fill
Yeah.
up the pill box. I was the person that all the family relied on to kind of say, oh, the baseline's a little off. This is not normal for him or her. And if there
Mhm.
was an emergency, I would be the one at the ER, and I would be the one, speaking on their behalf. But I also noticed there were a lot of people that wanted more than just a nurse coming in for a visit. They wanted a nurse for maybe continuous care at
Yeah.
home. And I found that it was very difficult for people to hire nurses to do that. The only options you really had were a registry, an
Mhm.
agency, or word of mouth. You find somebody through somebody and you take the risk of hiring them, not knowing.
Yeah.
um, so I started a private duty nurse registry a number of years ago in Los Angeles with another RN care manager, because we kept having clients who wanted nurses for round the clock care, whether it was short term, long term. And it got to the point where we needed to vet those nurses and
Yeah.
know those nurses, because we were bringing them into our patients' homes. And if we didn't know who they were, and we didn't know that they were, maybe
Exactly.
accountable or ethical or good,
Mhm.
it mattered. And so I
Yeah.
started a private duty nurse registry with another nurse care manager. But we were only able to help really wealthy people, because it was very cost prohibitive.
Yeah.
And the nurses would, charge a certain rate. And then the agency or registry, like
That's
we
true.
were, had to
Mhm.
charge an overhead to take care of
Mhm.
their costs. And I just kept thinking, there's so many families that need this care, that we could kind of bring it down a little bit so the nurses can still take home
Mhm.
a decent
And
paycheck.
mhm.
But we shouldn't have to be charging this 20 to 50% overhead. That really isn't much of a
Yeah.
value if you're not really bringing that to them. So
Mhm.
Call Light came to me like, hey, we can hire an Uber driver. We can hire a plumber. You can order food. You can have a masseuse come to your house. You can
Yeah.
have any of those things. Why can't we have some sort of accountability tool or platform where people can hire not just a babysitter, but a nurse, someone who
Yeah.
can come and check their blood pressure, check their,
Yeah.
give them an insulin shot if they need
Yeah.
it. People who already know how to use tube feedings and IVs and things, because I find that so many people are going home and people expect family members
I
to
know.
do these things.
With minimal instruction.
It's crazy. I can't even imagine going home with like an NG tube or something and not knowing, as a nurse, you learn over many years, like you got to make sure you keep flushing that thing, and you
Yes,
got
you
to
got
keep
to,
it
yeah.
patent, and you've got to do that. I just can't imagine. And I think that's why so many people end up coming back into the ER and
Yeah.
into the hospital, because they're not set up with,
Yeah.
sometimes they just need a nurse visit. And look,
Yeah.
home health and hospice, it's very limited in the
Mm-hmm.
scope and duration that is covered by
That is
insurance.
tough. Yeah. Mm-hmm.
So, and I found that with families, they want this sort of service. I found a lot of them hiring nurses from the hospital that they met,
Yeah. 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 Yeah.
but that
Yeah.
can be really risky for nurses too, because how do nurses know they're going to get paid? How do they know they're going to get treated fairly? And so with Call Light, I created a platform where there's accountability, there's ratings, there's reviews, there's, these boundaries and these safety guards, for
Mm-hmm.
both the client and the nurse.
And the provider. Yeah.
Yeah.
Absolutely. Absolutely. Because, I'm glad you mentioned, things like NG tubes and stuff like that, because, you should, people get shown maybe once, and in the first place, they go home and they don't really want to touch this thing. They don't really, and if they touch it only when they have to,
Yeah.
and that leaves out things like, as you said, flushing it appropriately and all of that kind of thing. Yeah, absolutely. They don't have enough time to get comfortable with it.
No, and I just think, well, there's more than 4 million nurses in the United States, for example, more than
Yeah.
4 million. And I
Mm-hmm.
think there's probably one close to almost anybody who needs
To
help.
anybody. Yeah.
And could we create a system where these nurses could even volunteer if they wanted? Because there are times I would, if someone needed nursing help on the side of the road and there was no one else, of course I would help.
You would be there.
Of course.
Yeah. Yeah.
And, and I also
Absolutely.
think insurance companies are starting to finally recognize, like, oh, it is much more efficient, cost effective to treat people at home
To
than
do
it
the-
is to send them to the
Absolutely.
hospital.
Absolutely. Absolutely. Hallelujah for that light bulb. Oops.
Yeah. Well, and I kept thinking someone else would build it. I had a newborn when this thing came to my mind. I thought, oh, this could be done so much easier, more efficiently,
Mhm.
more affordably. But I have a newborn. Someone else will do that. And now
It
he's
didn't
7.
happen.
He just turned 7 over the weekend. So I thought, oh man, I got to build this thing myself, don't I?
Didn't happen.
Yep.
What do you see nursing looking like in the next decade or so? I see there've been a lot of changes in the last decade. What do you see it looking like?
So I think nurses are finally starting to get their due. Like, people are starting to recognize the advanced practice that they can do.
Mhm.
There's so many different levels of nursing and specialties, and a nurse is not just a nurse.
Mhm.
I think people call many things nurses, and they're not nurses. It's like, no.
Mhm.
There's a very big, I heard someone say, oh, well, a regular nurse. And I said, well, it's actually a
What?
registered nurse, not a regular nurse. I feel really strongly that a lot of the nursing care and patient care is going to go back to the home. I really feel very strongly that's kind of where it started. And
Mhm.
I think we're slowly figuring out that that's where patients do the best.
Yeah.
That's where they're more comfortable. And I also think patients are going to be more compliant. No matter where home is, they usually want to be in their home with their own things and surrounded by. And the thing is, I find that if you can tell them, hey, we have to make some compromises. We're going to have a nurse come in once a day or something like that, a visit. In
Mhm.
order to keep you at home and keep you safe and where you want to be, we're going to have a couple of things that we're going to need to set in place, because maybe you don't need a nurse every day, but how good does your family feel knowing that there's a service if and when you do
Yeah.
need it, that
Yeah.
someone could come to you very quickly
Yeah.
and keep you out of the ER, keep you out
Yeah.
of, you know,
Yeah.
the things that you don't need. So
Yeah.
I think we're going forward, but we're really going back to the home. I think we're going to where patients need us. I think nurses are going to be having their nursing bags, and they're going to be going to where the patients are,
Where the patients are. Where the
wherever
patients
that
are.
is.
Yeah. And that cannot be a bad thing.
Mm-mm.
That cannot be a bad thing. You take away so much of the anxiety of the institution. That, you
I
know,
think of how many patients don't need to be spending half of their lives going to doctor's appointments.
really,
Some
indeed.
people love it. For some of my older adults, they loved it. They looked forward to going to the doctor's appointments and doing their social hour. But for my patients that had mobility issues or
Yeah.
cognitive impairment, I
Yeah.
found it was more harmful
Yeah.
to put them
Yeah.
into this van with a wheelchair and bouncing around, and they don't know where they are, and it takes half an hour to get there if you're lucky, and then you spend how much time waiting, and then it just didn't make sense to me. I thought we were doing so much more harm by forcing these patients to go for a
Yep.
routine appointment that could be done at
Appointment,
home.
right. And the anxiety level is building for days prior to
Yes.
this. Yeah.
Yes.
Yeah. So what 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 would you say to someone who wants to be a nurse today?
I would say find a mentor, find a
Mm,
group, find someone who's a little bit further along than you are. Someone, and I think it could be any sort of type of nurse. It doesn't have to be the type of nurse that you want to be, but someone who has just been down that path a little bit more, because they already know the pitfalls over here, the
mm-hmm.
opportunities over here. They already have an idea, like the atlas. They
Yeah.
know the directions you could go. They can see things that you're not aware of. So I think finding a mentor, and even just finding a core group of nurses that are in different fields, because I think we get so siloed in our little area,
We do.
and we
Hmm.
don't realize that there's so much more out there. And I think it's hard to find your place in the world, and as a profession I think it takes a little bit. You try a couple of things and you find out, wow, I had no idea that home care or hospice was so
Mhm,
like
mhm.
maybe in one part of your nursing career that's boring and you don't want to
Mhm.
do that, and you can't imagine doing one-on-one patient
Yeah.
care in a home. But then after a point, you start to recognize, this is what I miss. I miss spending time with these patients. They need someone to talk to. They need someone to listen to them. They need someone who is a regular face,
Yeah.
who they know, who knows them, and who they learn
Hmm.
to trust. And
Hmm.
it takes a long time for a patient to feel comfortable talking to anyone.
To anybody. Hmm.
And I think
Yeah.
nurses are really poised to be that
Yeah.
liaison. Think of how many things your patients have told you that they wouldn't tell their own families.
Exactly. 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 To them, you're like a vault.
Yeah. It's like a hairdresser. You know everything.
Yeah. Yes, indeed. Yes, indeed. Yeah. But you mentioned that there were so many areas that people could go, so many different areas in nursing, and how so many of us have gone through nursing, not realizing how vast it is. I myself spent most of my career, I think, not realizing just how vast. I always knew that you could do this or you could do that, but I didn't know you could do that.
There's so much
Right?
you can do. I think what I did really well is I kept, maybe it's because I was a little bit older when it came to nursing. I wasn't
Mhm.
20. I was almost
Right.
30. And so
Mm.
I kept my ears a little bit more open. And if a door opened, I would take a peek in there. And if certain doors kept opening, I was like, okay, this is a trend. I'm starting to see a lot of people need this, and I like this, and I feel like I'm making a difference. Well, I'm going to go in that door. That feels right.
Yeah. 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 That's one of the things that prompted me to do this, is that I really, really, really want nurses coming along to see what nurses are doing, and to feel that pride in what nurses are doing and can do and have done, and you can go it too.
There's so many things that people asked me. Oh, Courtney, can you write a care plan for court? You speak a different language. We don't understand it. You're translating in a way. And it just felt so good. I would just say, I haven't done that before, but I think I could do it if you tell me what you need.
Yeah, indeed. Indeed. So one thing that we're talking about a lot is self-care. What does it mean to you?
Oh, self-care. It's so hard for caregivers, I think, like to practice what you preach.
Yeah.
And to put your own oxygen mask on
Yeah.
before, I think nurses are starting to really recognize that we have to take care of ourselves. And for me, it's I go for a walk by myself. I listen to something, like Eckhart Tolle or Oprah or something. I'll do yoga. I'll just really have to take some time to decompress and because we carry so much when we're with patients. And in order to, not have that all the time, we lose people that we love, and there are things out of our control that are very heartbreaking to deal with. And in order to not burn ourselves out, we have to take care of ourselves, and I think we have to talk to someone. If you don't have someone, like, you need to find someone who you can talk to openly. Because I always thought in the hospital, how great would it be if they had counseling on site? Because as nurses and doctors and healthcare professionals, we see some of the most traumatic things, and then we're expected to just, oh, your next patient's coming.
Yep. There is little to no debriefing. And as you said, we carry so much. And we just accept that we're expected to carry that much. And so we just somehow pull it in and bury it and try to move on and just accept all of this load. When in fact we should be shedding it somewhere.
Yeah, I think even if it's just like a peer group, or if they had someone on call in these locations, even if it was just telehealth, just so a hospice nurse or any type of nurse at the end of their shift or whenever could just call in and say, I just experienced, the hardest loss, or, this happened. And just to be able to talk about it with someone.
Yeah. Or even if it's just to say, today, I'm not really okay.
Yeah.
I'm not really okay.
Yeah.
Maybe we will get there.
I think we're slowly getting there. I think with technology and telehealth, I think we're actually starting to see some breakthroughs where people will recognize that, hey, we got to take care of our healthcare professionals, because they can't take care of other people if we're not taking care of them.
Exactly. Before we go, any gem you'd like to leave us with?
I feel like we're on the verge of something really great for nursing. I really do. I know with the pandemic, it was really hard to see sort of what nurses went through and things like that. But I also feel like nurses are really in a position to take their power of advocacy, of, impact and change. And I feel like the future of nursing is so much brighter, because together, when we all stand together and we speak up, there's nothing more powerful than a group of nurses who care about their patients. And that's I just feel like the future of nursing is so much brighter because we're all starting to see each other and connect in a way that we hadn't before. So
Yes.
I feel optimistic about the future of nursing because I feel like it's up to us to really fix this.
It is up to us.
Broken
It is up to
system.
us. Yes, it is up to us. And as you say, I think I think I agree with you. We're kind of like approaching critical mass, you know, where it's going to be like,
Yeah.
yeah. Thank you so much for this conversation, Courtney. I truly enjoyed it. Thank you.
Thank you. Thank you so much, Dale. It was so nice speaking with you.
And you. It's my pleasure.